just kind of simple stuff.
Yeah.
Yeah, we also had prepared remarks for her.
Yeah. So her remarks are already up there.
Yeah.
Gotcha. Okay.
Yeah.
Okay.
And so after she makes her remarks, I guess anything, if you pretty much want to just piggyback on any of her remarks, any questions, really to the questions you already have, obviously. And then just one or two of those, and so she could give her answers, and then also how to do the next step.
Sentences randomly from all over the show.
Okay. Okay.
Yeah, and our IEA and our watch comms team would request the review.
Okay. Okay.
Yeah.
Yeah. They didn't actually prep me with any questions before getting here, so I was kind of just reading the video press thing, and so I was kind of like, okay, I could probably maybe ask this and that, but
Yeah.
yeah, they just didn't prep me. I don't know. I was covering another story. You didn't get here.
Kelly, this is Sanford.
Sanford,
nice to meet you.
Glad you could make it. Same thing. Over on days and. So yeah, we were just discussing setup. So we're pretty much going to have an introduction of who Admiral Rachel Levine is, and then Michael, and then she'll make her remarks, and then we'll have kind of our food bank kind of more community relations liaison speak, and then time for like 1 or 2 questions.
Okay.
With also Roy.
Okay.
From Boston.
Hey, Sanford now, Kurt, nice to meet you.
Nice to meet you. I'm Roy.
Hi, I'm Lonnie, I'm with office, Assistant Secretary for Health.
Okay, great.
You want to use my card, so I'm with the Dallas office, so I'm a public affairs specialist for
Thank you.
our region. So anytime we're in the San Antonio area, I'll be down there.
Oh, okay, great.
Michael, can you do me a favor and give me a quick sound check?
You bet, sir.
I think this should be it.
Hey,
how are you?
Let me know when it's good.
Yeah, whenever you're ready.
Yeah, sound check, mic check, 1, 2, 3, 4. This is Michael Guss, San Antonio. Feedback, mic check, 1, 2, 3, 4.
Thank you.
Copy that.
That's fine. Yeah. Yeah. It's
Switching
better
it?
for us to be like
I
a
just
little
wanted to
below
see
than
how
like
much
track
room.
something.
Oh, gotcha, yeah.
Yeah, it's still September, so.
Yeah, we have a few more. We don't have to do that all. Yeah, and I know like Adam is doing his own like food is medicine video series, and there's like a lot of content that we can repurpose. Yeah. Yeah.
Planning on having a microphone meeting?
Okay, let me pull that off. Yeah.
Should be questions like the content or anything. Yeah. Promotional safety, nutrition, those people. And yeah, we have some new stuff going on soon in September. Food is medicine, which is on the national level, but also on San Antonio, our city, this area.
Okay, great. And is she gonna be able to talk about, concerns about, whether food insecurity is going up or going down, or how this being done? Okay, okay. Okay.
That was fabulous. Thank you. Yeah, that was great. Good, yeah, the energy in the room was unbelievable.
I'll stick on this.
As everybody left, you're like, good job. Showing off as a collaborative, so. Hi.
Hello.
And, I'll move mine.
okay.
I'm gonna introduce you here in a second.
Oh, okay, thank you. I had already marked up mine,
Okay.
so we'll get there, if I can find it. And I will. There we go. Yeah. Hi. How you doing? I'm Rachel Levine. I'm the Assistant Secretary for Health. Introduce yourself.
Sure, I'm Kelly. I work
Oh my goodness.
I was like, I better come.
There you go. Well, thank you so much.
That's part of the team.
My name is Suzanne Stegman, and I'm on the philanthropy team
Oh.
under Michael.
Wonderful.
Sanford Nowlin, I'm the editor-in-chief of the San Antonio Current.
Oh, wonderful. Thank you so much for coming.
Right.
I'm Tyler Hanna, creative manager here at the San Antonio Food Bank.
Great.
I'm Roy Ohoso with Fox News.
Okay, wonderful. Well, so I was really so pleased to be here at the San Antonio Food Bank and to join this community roundtable. I'm Admiral Rachel Levine. I'm the Assistant Secretary for Health and the head of the United States Public Health Service Commission Corps. And you know, this is Hunger Action Month, which is Feeding America's Hunger Awareness Campaign. And you know, it was really great to come to the San Antonio Food Bank to see their garden, to see their culinary program about learning how to cook food. And then they have a roundtable really with many different participants across San Antonio as well as Bexar County about food insecurity, about nutrition insecurity, and about food is medicine. And so we recognize, like the food bank, the importance of having access to healthy food, and access to healthy food. Just having fast food doesn't do it. You need to have access to healthy, nutritious food. And it's incredibly important and has a big impact on people's quality of life, because healthy food is a fundamental human need, and healthy food is a fundamental human right. So the Biden-Harris administration has prioritized Food is Medicine initiative to prevent and then treat chronic diseases in childhood, in adolescence, in adulthood, and for seniors. So in 2022, the White House had the White House Conference on Hunger, Nutrition, and Health, and we've been working through HHS under Secretary Javier Becerra and through my Office of Disease Prevention Health Promotion on a Food is Medicine initiative. We want to unify, collaborate, and advance collective action. So we're working to create a suite of resources. They'll be made into a virtual toolkit, and we're working to have this toolkit online and available later in September. So it was great to be here at the San Antonio Food Bank. I know they have been a champion and a leader in the food is medicine landscape, and look forward to more collaboration. During the roundtable, we talked a lot about how important collaboration is, how fundamental that is in San Antonio, and how much collaboration there is, but then yet how much more needs to be done. Nutrition is one component of what we call the social determinants of health, those social factors that influence health. And that includes, of course, healthcare access, but it also includes, again, nutrition, food and nutrition security. It includes the environment. It includes education. It includes housing and transportation. And they were at the table. Education and some of the universities and the community college was at the table. Challenges in terms of economic opportunity, and they were at the table. They all kind of work together for health. And so we saw that type of collaboration that exists in San Antonio, but we need to do more, and so that's what we're working for in the Biden-Harris administration. So I'm pleased to answer any questions.
I periodically get news releases from the food bank, and there are periods of stability, but also periods where they're concerned about the economic situation out
Right,
here,
right.
and growing needs. And I'm wondering if you see not just food insecurity being sort of in this constant state of need in the United States right now, but nutrition insecurity being a pressing thing that we should be paying more attention to.
It is. So food and nutrition insecurity is a pressing need, and I have seen that in my travels across the country. So it was discussed about in San Antonio. It was discussed where in South San Antonio that there are increased needs, increased health and nutrition disparities. I have seen that in East St. Louis, which is in Illinois, where there's food and nutrition security. I have seen it in Louisiana. I've seen it in the Navajo Nation. I've seen it in Alaska. I'm on Alaska Native tribes. And there are so many different factors that influence that. For example, one of those factors is the influence of climate change and extreme heat. Changing agricultural practices, changing and influencing the native food sources in Alaska, influencing food and health in the Navajo Nation. And so that is one factor. Economic opportunity, which has been fundamental in the Biden-Harris administration, is critical. One of the people mentioned how critical transportation is. Because you can have food sometimes brought to you, but transportation for healthcare access, transportation for economic opportunity, housing, it all fits together.
Do you see that climate change situation affecting food insecurity and nutrition insecurity in South Texas?
So I think it does. I think it does in terms of agriculture. So for example, I went to the garden here, and certain crops will grow here, certain crops won't. I think that the extreme heat that the Southwest has experienced does influence agriculture, and thus it influences nutrition security. Extreme heat is one of the biggest challenges that we face, not only in the Southwest, but I've seen examples of extreme heat in Seattle, in New York City, and Boston, of course in Florida, in Chicago. I mean, really the entire country is influenced by extreme heat. Nobody more than in the Southwest, and of course we've seen that throughout the world. And then storms that are, including hurricanes, but also other storms that are stoked and driven by the influence of heat and climate change. I was in 2 weeks ago in Vermont, where they've had these torrential rainstorms that have caused horrible flooding. And I was in someone's neighborhood, and they said, "Well, there goes my refrigerator just floating by," because of the influence of those storms, which are exacerbated by extreme heat and by climate change. So really, climate change and the influence of climate change on health is one of the existential health risks of our time. When people ask, what keeps you up at night, that is the risk that keeps us up at night, is the influence of inexorable climate change on health. And so we have an Office of Climate Change and Health Equity at HHS that we formed 3 years ago, based upon an executive order from President Biden that is looking at this. Health has a seat at the National Climate Task Force. Secretary Becerra has a seat. We've gone to the Conference of Parties. We went to I was at COP26 in Glasgow and COP28 in Dubai, and then our team was at COP27 in Egypt, and the team is going to COP29 in Azerbaijan to talk about these health impacts of climate change.
Rick or Tyler?
Anything else?
No.
Okay, all right.
Tyler, any questions?
Please.
I'll keep
Keep going. Keep going. All right. I'll keep talking.
I would imagine that, especially before we hit the catastrophic point of no return, the impacts aren't going to be felt equally. In other words, if I have a lower income, produce, nutritional foods are going to get more and more expensive for me.
Yes.
Whereas a certain part of the population, at least for a while, is going to be insulated. So is your concern that the initial impact nutritionally of climate change is going to fall hardest on those in the lower income brackets?
Absolutely. And that is why our office is our Office of Climate Change and Health Equity. So under Secretary Becerra, health equity is fundamental to all of our work at HHS, including the impacts of climate change on health, because it's the same communities that already suffer food and nutrition insecurity, that already have challenges in terms of housing and transportation and lack of healthcare access. Those same communities are going to be suffering from the impacts of climate change and the impacts of climate change on nutrition, particularly, for example, communities of color. the Hispanic Latino community, the Black African American community, the American Indian Alaska Native communities that have suffered health disparities most acutely and continue to suffer those, and will feel those most acutely from climate change.
Sanford, I wonder if I could just jump in and join you just for a second.
Yes, please.
Because I think, please stay here now, that this topic of food as medicine is really important for food banks around the nation. You know, all the counties of the United States are covered by a Feeding America Food Bank. We have an MOU as a network of food banks with HHS.
Yep.
The team has worked really hard around food as medicine. Because we know all too often, right, the healthcare is sick care, right? There's a focus on intervention and not prevention. And that many, many people who are needing to recover from illness, either one, might have access to the food they need to take with their medicine.
That's right.
Right? So that's often a problem. Or just the whole idea that as we move into this future that you've described, what would it look like to have a prescription from a pharmacy, an FARM pharmacy, to go with your script that you might get from your local drugstore, so to say. And so I think that's the place that we are hopeful that we can move holistically as food banks, is where Medicaid and Medicare will be able to cover from a reimbursement that food prescription for a food insecure individual who needs that for medicine, right? For that nutritious food. We think that's really key to the future. So we're kind of excited about what that could look like.
Absolutely. So, under Secretary Becerra, we really are emphasizing this idea is that food is medicine, both from a preventive perspective and also from a treatment perspective. So one of the participants in the roundtable came up to me and were talking about the rates of type 2 diabetes in this area, even among young people. And so we can prevent, in most people, type 2 diabetes using a food as medicine approach and proper nutrition. And then for individuals and families that do have type 2 diabetes, we can treat it with food is medicine. We can treat it with that. And so, there are new medications coming out in terms of type 2 diabetes, the GLP-1s, etc. But if we can use food as medicine, it's a lot more holistic, and it's a lot less expensive than expensive injectable medications. They have their role, but we can prevent and treat a lot of the chronic health conditions we see, such as hypertension, such as heart disease, such as diabetes, and more, with a food as medicine approach. So that's what we're working on.
He mentioned, Medicare, Medicaid
Right.
reimbursement on that kind of thing. Is there some legislation that could be moved forward to try to make sure that happens? How far away might we be from that kind of thing?
So there are some states that have had CMS waivers to do food in terms of Medicaid covering food. We can get you those states that have done that. I believe Oregon is one of them, but our team can get you those states that have done waivers through CMS to be able to do that. So some of this can be driven from the federal government and needs to be through innovation. Some of it can be through innovative programs at CMS. Some of it, of course, can come from Congress. And then some of it needs to be, of course, at the state and local level as well.
Makes sense. I'm tracking. Yeah, we're hopeful. We're hopeful.
I hope you're not expecting the state of Texas to be out front on this.
No. But I think the other piece of this.
Community perspective.
Yeah.
Okay, sure,
Yeah.
please.
Yeah.
Andrea Guajardo, who heads up the Bexar County Health Department.
Come to the podium.
Thank you. Hi, Dr. Andrea Guerrera. Nice to meet you all. Are there questions, or you just wanted me to talk about what just happened in the room?
That'd be great if you could make a statement first.
Yeah, that'd be
Yeah,
fine.
well, we appreciate Admiral Levine's visit. It's a great honor that she and her team are here to meet all of the folks that are working not only on food insecurity, but I think the meeting today really highlighted cross-sector collaboration. We had folks in the room that are working on transportation, folks in the room that are working on food insecurity, on healthcare, on diabetes, registered dietitians. And so there are lots of housing, another huge one. So what we traditionally call social determinants of health, whether or not you're able to have a well-paying job, and whether or not you live in a safe neighborhood, whether or not you have transportation to get to your job, all of these things that contribute to a family's overall well-being, those things have to be integrated and work together in order for people to be successful, to thrive. And that's what we want for San Antonio and Bexar County. And so having the opportunity to meet with with the team from HHS really, I think, reminds all of us that are working in this space that we do have a lot of work to do. Although there's lots of collaboration, San Antonio is extremely well networked, and we have lots of coalitions and collaborations that work together. It's nice to get everybody in the room and see each other face to face and remind ourselves that our families need us. Our families need all of these things, what we used to call social determinants of health, the state of Texas calls non-medical drivers of health, but the things that are essential to where people thriving where they live, work, play, and pray.
Can you talk about the collaborative efforts that are being done here to address some of the climate change issues that the Admiral talked about?
Yeah, I mean, collaborative efforts exist probably in every single sector. There are housing collaboratives, there are food collaboratives, there is the health collaborative that creates our community health needs assessment for the community and the subsequent community health improvement plan. We have a collaborative for health insurance enrollment to make sure that folks are aware of the benefits of the Affordable Care Act. We have a partnership, which is a partnership focused on youth and education. And so I think all of these collaborations together are the like I said, the cross-sector cooperation that has to happen.
Let me just add in this piece, and no, please stay where you are. That this concept of food as medicine really is a holistic concept.
Yes, it is.
I think that came through in our gathering. That it can't be food only, right? It's all those key pieces that help a community to thrive. We know nutrition as food is part of that, but obviously education, the workforce, transportation, they roll around the table. So it's an interesting when you gather healthcare that you have a much bigger collaborative from animal ecologists to VIA, all of our partners, Opportunity Home, around the table, talking about this, what we think is just healthcare, food as medicine, but it's much more integrated, and San Antonio really can lead the way for the nation when it comes to this.
Yeah, food is life sustaining, but it's also education sustaining. If a child is hungry when they're at school, if a college student doesn't have adequate nutrition, they are not going to have successful outcomes in education. If a person is sick and they don't have adequate nutrition, they're less likely to be able to combat their condition, whether it's acute or chronic. So food is not just something that, it's nice to have organic foods, and we have grocery stores in some parts of the county, and then we have food deserts in other parts of the county. But when we say food is medicine, it's really not just to treat the sick, but it's really to sustain every single part of our lives and to be successful.
We're about 2 minutes, I think, because I know that we have to get the Admiral to a call at 4:10, but any last questions for any of you all? Mario, did you have?
Yeah, I was just gonna say, it was mentioned the south side, right, but west side, south side, east side, we know those areas, right? And we're working hard at that. I don't know.
Yeah, I mean,
Doctor, do you wanna?
there is this narrative about the north and south dichotomy of haves and have-nots and the disparities, and that is true. That UHS mentioned that they have done a community health needs assessment that compares health outcomes from south of 90 to the rest of the county, and what we know is that all of the same issues that affect health conditions that affect everyone in Bexar County happen on the south side, just in greater magnitude and a greater impact. But you will find, if you travel to certain neighborhoods, what I call cultural enclaves, where you might have an area of a zip code on the north side in Precinct 3 or in District 10, whatever your frame of reference is, that is a food desert or only has access to fast food within a mile or two. Although we do have greater disparities north and south, it affects almost every single neighborhood in the county.
I would imagine too, in some of those northern areas, if somebody doesn't have a car, that's pretty difficult for them to.
Yeah, if you have a less walkable neighborhood, and I mean, we've all heard the statistic that the disparity in life expectancy from a northern zip code up in the northwest side near UTSA versus a zip code in the south side is more than 20 years. The difference between living 50 years and living 70 years is huge, and a lot of that has to do with access to healthcare, access to food, and access to all of those non-medical drivers of health.
I would just like to, in my final comments, just highlight the great work being done by the San Antonio Food Bank. Really, the visit here was really very illuminating and eye-opening. I think they're doing a fantastic job in terms of food and nutrition security, in terms of the concept of food as medicine, and then really collaborating with all of the other partners that were at the table, that were at the community roundtable, and they all the different members were at the roundtable were highlighting the great outreach and the great work by the San Antonio Food Bank. So it was a pleasure to be here.
Thank you, Admiral.
Thank you.
Thank you guys for being here too as well.
Thanks. Nice to see you.
Thank you.
Nice to see you. Okay.
You need anything, pull off something, you get what you need, you think? You
I
can
think I'm
interview?
good.
Okay, yeah.
We have some pretty good questions.
Yeah, making sure. So, Sanford, are you good on your side?
I think so, yeah,
Okay.
appreciate it.
Tell her you got what you needed. Okay, great. All right. Raquel, we wrap. Way to flex. Okay, well, thank you.
Yeah, thank you.
So are y'all walking back over, either Suzanne or are y'all walking back to the building? Yeah. Could you just make sure Sanford, he's parked, I think, out by our building, just to get him up across campus?
Oh, yeah, for
Do you
sure.
mind? Bring him that way? You have a tour guide now.
Oh, great, okay.
Thank you, sir.
Thank you.
Nice to meet you. I'm Kelly.
Nice to meet
I
you,
work
Kelly.
on the transcript team.
What's your name again?
Questions, I wasn't prepared to.
Oh, yeah. And if you don't need a sound bite, I'm okay, or if you do,
I'll
tell me.
be down to get like a little quick sound. just
yeah,
in case.
sure, I can, yeah.
Yeah.
Is yours?
Yeah.
Okay. I think I called you Rick earlier, Roy. Sorry about that.
Rick, I didn't even hear. I thought you said Roy.
Oh, good. Maybe I did that. All of a sudden, I was like, maybe.
Actually, gonna be looking right at me on
You
this.
bet.
All right. So it's gonna be for the producers. Can you say your first and last name?
You bet. Michael Guerra, Michaelguerra. I'm the Chief Sustainability Officer, San Antonio Food Bank.
Okay, so I know we kind of already talked about this already, but can you just tell us a little bit about, where we at and what was happening here? Y'all had the round table there. Can you just tell us? Yeah.
Yeah, the San Antonio. Oh, sorry. The San
Oh, no,
Antonio.
no, he's good.
I was
He's
like,
good.
zip me up. No. The San Antonio Food Bank today hosted Admiral Rachel Levine from the Health and Human Services Office in D.C. Really to talk about that idea of food as medicine. We all know that food is healthy, but the thought of could you get a prescription for a pharmacy, an FARM, just like you would to your drugstore. So getting a prescription for food, and especially for healthy food. We know that eating better will bring down diabetes, right? Heart disease. So many things related to proper nutrition, but you can't get a prescription for it these days. How amazing would it be if your doc could write you that script to go get fruits and vegetables from your local food bank? And in our idea, the food as medicine concept offers a more holistic kind of framework than just food, because we can do all the wraparound services that somebody might need. Do they have transportation challenges? We know the housing people. What about college and work? So getting that food prescription might just be the first step in a more holistic solution to food as medicine.
And for, I guess for the people here, how can they find out which type of foods, at least so they can be aware of, like, this is what's going to help me here?
You bet. There's so many great resources in San Antonio to find out about healthy eating, right? So our Metro Health Department, our local San Antonio Food Bank at our website, I think just taking the time, though, to whether you need to find resources in English or Spanish, we need to find them for children or for seniors or somebody in between. It's just important to take a stop and then to develop the behaviors, right? It's changing those habits. It's often so hard because it's so easy to get the quick food that might fill you up but might not be good for you. So what our dietitians tell us is taking time just to prepare. Doing just simple meal planning is one of the most important things you can do. You might have a refrigerator stocked with great fruits and vegetables, but if you don't stop, take the time to do your meal prep and to plan ahead, you might not actually eat what's in your refrigerator already. So the discipline of taking time, stopping, slowing, and preparing and thinking healthy, that's going to go a long way.
So how hard are y'all at working at trying to make these resources possible, and how long do you think it would maybe take before something like that kicks in for people?
Yeah, when it comes to the San Antonio Food Bank and Food is Medicine, we have a team of 12 trained nutrition educators. They're bilingual and in their community every day. They're teaching kids at pre-K. They're teaching seniors and new moms. They're teaching expectant moms about healthy eating. It's like, what a perfect thing to get a new or expectant mom, the kind of thinking, the tools, and the behaviors so that they can start that child off right, cooking those healthy meals, those right meals for them. So we're in community every day, and not just in San Antonio or Bexar County, but in a 29 county region, just really trying to make sure that once you've gotten those things from the food bank or from your local grocery store, you know what to do with them. And so it's our privilege to be out teaching and helping to strengthen the community that way.
And for the people at home, what is something that you want them to know from this?
Ooh, that's a great question. So much. Yeah. I think one of the most important things today around food is medicine is that we know the importance of, well, let me start over. That stumped me. Tyler, do you have an answer for that? No.
Maybe food insecurity isn't just food insecurity.
But nutrition security too. Yeah, that's what I was thinking of. Your San Antonio Food Bank is known for helping to get groceries to people, right? And that's really helping to kind of stem food insecurity so that you do know where your next meal comes from. But once you have the meal, you still could be nutrition insecure. You just might not know how to prepare it. You might not know how to shop once you get the resources. So I think that one of the big messages today, the San Antonio Food Bank is working equally hard at nutrition security as it is to food insecurity. And that's why we had this great roundtable today, having Admiral Levine come in from DC, just to spread that message and to give a more holistic concept to our work.
Awesome. And what does that mean to you, just having her here, having her come all the way down from DC to be here? I mean, what's that mean for you?
Yeah, I mean, I think for all of our San Antonio team, an inspiration to have Admiral Levine here, to hear her kind of thinking about the forward movement of food, as she talked about food and climate, food and nutrition, and food as medicine. It's exactly what our community needs to hear moving forward. Callie, was that okay?
All right.
She's my boss. I just want to make sure. So.
Oh, okay. Nice.
Thank you.
Thank you. I appreciate it.
We appreciate you so much.
Oh my gosh,
Excellent.
you're most welcome.
Yeah, it's a great tag team, have that local perspective, and I think it's just great synergy. So
Good. Well,
we're happy.
thanks for your patience with us and
No, of
helping to
course.
train us. That's
No.
something we do all the time. Having that, someone like that.
This might be so very nice.
Yeah, but you did great.
Like, this is my first thing.
Yeah, I know. Super.
Thank you. Yeah.
You're natural.
Tyler.
So you did great.
Thank you.
You're welcome.
Yeah, I can't wait to come back to San Antonio, and then we'll be coming back in October, so
Okay.
we make this great time to do another stop.
Sure, yeah, please. Yeah, there's a bunch to see.
Yeah.
It's a fun place. You staying over, you going back there?
No, we're gonna stay the night, we have a meeting tomorrow with the San Antonio Football Foundation.
Yeah.
So, yeah.
That's awesome. AIDS, call it, I forget that it's a group, but
Yeah.
you do good work. They're in our neighborhood. In fact, I live in that.
I know open enrollment is coming up, are y'all hoping to enroll people on health insurance? Is that something y'all see, or I know the Medicaid,
In fact, it's funny when all the insurance companies are bidding, they're always trying to get our food too. Like, hey, can we
Yeah.
can we give it to these patients?
Yeah.
We're-
yes, I know that's always
Yeah,
a big
Kevin
portion.
gave me some pointers.
So if you want to just kind of sit with our staff that's doing that or see us or shadow them, just watch.